Hello, and thank you for watching Health Concerns and Psychiatric Illness, brought to you by Oakland Community Health Network. This educational PowerPoint is part of the Oakland Community Integrated Healthcare Collaboration Project, which allows for individual organizations to develop the level of staff training needs based upon position and job responsibilities, upward movement in terms of skill competency for staff, and coordinated primary care needs of people with severe mental illness or intellectual and developmental disabilities. The agenda includes introductions, integrated health care and health concerns, physical health risk factors, common health problems, common health issues, metabolic syndrome and medication issues, substance use, communicable diseases, role and perspective changes, summary and conclusion. At the end of this course, participants will understand reasons for earlier death rates among people with a mental illness, be able to identify the primary health concerns of people living with a mental illness, recognize side effects of psychotropic medications, understand the role of substance use in physical health, and have a broader understanding of communicable diseases. Integrated healthcare includes the management and delivery of health services so that clients receive a continuum of preventive and curative services according to their needs over time and across different levels of the health system. According to the National Alliance of Mental Illness, 1 in 4 adults, approximately 61.5 million Americans, experiences mental illness in a given year. 1 in 17, about 13.6 million, live with a serious mental illness such as schizophrenia, major depression, or bipolar disorder. Why is it individuals with whom we work with have a greater chance of dying younger than the general population? Do social and physical factors play a role? Approximately 15% of adults aged 60 and over suffer from a mental disorder. Globally, an estimated 350 million people are affected by depression. More women are affected than men. 68% of people diagnosed with a mental illness are dealing with at least one challenging physical health condition. Some of the risk factors contributing to mortality are social environment, which includes homelessness, unemployment, poverty, trauma, social isolation, and poor or no medical care. And with physical factors, those would include smoking, substance use or IV drug use, poor nutrition, lack of exercise, side effects of medications, and poor or no medical care. The big 5 health concerns along with mental illness include obesity, hypertension, diabetes, COPD, and asthma in children. Obesity is a condition characterized by the excessive accumulation and storage of fat in the body. 42% of individuals with a mental illness have been affected with obesity versus the general population at 28%. Worldwide, obesity has more than doubled since 1980. Individuals dealing with obesity have a 3 to 6 times greater risk of having metabolic syndrome. And metabolic syndrome is a group of risk factors that include when a person has increased blood pressure, an increased waist circumference of abdominal fat, high blood sugar, and an unhealthy cholesterol level, and this puts someone at risk for diabetes, heart disease, and stroke. Obesity can be defined through measuring a person's body mass index related to height and weight. A person's weight in kilograms divided by their height in meters squared is defined as body mass index. An average BMI for an adult is 18.5 through 24.9. This is an example of a body mass index chart. Weight in pounds is on the far left side going vertically, and on the far right vertically is weight in kilograms. Across the bottom is height in inches and centimeters. To figure a body mass index, you'll take your weight, whether it's in pounds or kilograms, and that goes across horizontally on the horizontal lines, and the height will go up and down vertically, and you want to come to a matching point and then see where the weight range is. And normal is the green area where the body mass index shows as 18.5 and it ends at 25. High blood pressure, also known as hypertension, and abbreviated hypertension is HTN, and high blood pressure is abbreviated as HBP. High blood pressure is a sign that the heart and blood vessels are being overworked. And if this goes untreated, it can lead to atherosclerosis, which is a buildup of plaque in the arteries, and congestive heart failure, which is an enlarged heart and a thickening in the heart wall. High blood pressure is when the force of blood pushing against the walls of blood vessels is consistently too high. The size and elasticity of the artery walls also affects blood pressure. High blood pressure, also known as hypertension, may occur for years without any symptoms. Even without symptoms, damage to blood vessels and the heart continues and can be detected. Uncontrolled high blood pressure increases the risk of serious health problems, including heart attack and stroke. Hypertension is the leading cause of death and disability in the United States, and it affects 76.4 million adults. A blood pressure reading of 130/80 milligrams per mercury or higher is considered high blood pressure for an adult. Normal blood pressure is below 120/80 milligrams per mercury. The American Heart Association blood pressure guide is noted here as a link. High blood pressure can be managed by a primary care physician or a cardiologist along with prescribed medication and/or diet and exercise. Some risk factors for hypertension include age, genetics, stress, diet, being overweight, smoking, drinking excessively, and lack of exercise. Diabetes is a disease where the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated levels of glucose or blood sugar in the blood and urine. Diabetes facts. 1 in 12 Americans has diabetes. More than 25 million people in the United States have diabetes. One form of treatment modality is insulin. When people have diabetes, glucose builds up in their blood. Having a higher amount of glucose in the blood can damage tissues and organs. Risk factors for diabetes include being overweight, having more belly fat, inactivity, a family history of diabetes, a person's race, a person's age, and diabetes symptoms include having to urinate often, frequent thirst and hunger, extremely fatigued, blurred vision, cuts and bruises that are slow to heal, and having tingling, pain, or numbness in the hands and feet. Chronic obstructive pulmonary disease, also known as COPD abbreviated, refers to a group of lung diseases that block airflow and make breathing difficult. The causes of airway obstruction in COPD include emphysema and chronic bronchitis. Emphysema causes destruction of the fragile walls and elastic fibers of the alveoli. Small airways collapse during exhalation, impairing airflow out of the lungs. Chronic bronchitis causes the lungs to produce more mucus, which can further block the narrowed tubes. People develop a chronic cough trying to clear the airway. Approximately 11 million people in the United States are diagnosed with COPD. Smoking is the main cause of COPD. COPD can also be caused by exposure to fumes or poor ventilation when cooking. People with COPD likely experience episodes called exacerbations, during which their symptoms worsen and persist for a day or longer. COPD symptoms include constant coughing or a cough. This increases mucus production, shortness of breath, chest tightness, or wheezing. Treatment for COPD includes anti-inflammatories or bronchodilators. Some of the complications of COPD include respiratory infections. A person's more susceptible to colds, the flu, and pneumonia. High blood pressure, and the pulmonary arteries that bring blood to the lungs due to inflammation and loss of capillary blood vessels. Heart problems due to an increased risk of heart disease, including heart attacks due to lower oxygen levels in the pulmonary arteries. Lung cancer due to cigarette smoking and premature lung aging. And depression. Difficulty breathing can keep a person from doing the activities they enjoy. Test for COPD. There's pulmonary function test. Spirometry is the most common and non-invasive. This test measures airflow into and out of the lungs. Chest X-ray. This can show emphysema and rule out lung problems or heart failure. A CT scan. This detects emphysema and may determine if surgery will be beneficial. It can also rule out lung cancer. Arterial blood gas analysis. This measures how well the lungs are bringing oxygen into the blood and removing carbon dioxide. The most essential step in the treatment for COPD is to stop smoking. It is the only way to keep COPD from getting worse. Best outcomes for smoking cessation is a combination of these three aids: nicotine replacement, medication management discussed with a psychiatrist or family physician, and a smoking cessation group to give support. Asthma is a respiratory condition marked by spasms in the bronchi of the lungs causing difficulty in breathing. It usually results from an allergic reaction or other forms of hypersensitivity. Symptoms of asthma include coughing, especially at night, a wheezing or whistling sound, especially when breathing out, trouble breathing or fast breathing that causes the skin around the ribs or neck to pull in tightly, frequent colds that settle in the chest. The treatment for asthma depends on the severity and frequency of the symptoms. To deal with childhood asthma, the doctor may prescribe two types of medicines. Quick relief is for any child who has asthma and needs a quick relief medicine to treat the noisy part of the disease, the coughing, wheezing, and shortness of breath that occur with symptoms or an asthma attack. This medicine, typically an inhaler, should be with the child at all times for use at the first sign of symptoms. Long-term control, this type of medicine is needed by some children to treat the quiet part of asthma, the inflammation of the airways. It is taken daily to prevent asthma symptoms and attacks. Metabolic syndrome results from risk factors that can occur with aging and increases the likelihood of stroke, type 2 diabetes, and heart disease. Indicators of metabolic syndrome include an increase in blood pressure, higher than 130/80 most readings, a higher fasting glucose level. A normal glucose level is between 80 to 110 before eating. A more pear shape to the body, men having a 40-inch or more waist measurement and women 35 inches or more waist measurement. A lower HDL cholesterol with a higher LDL cholesterol, and higher triglycerides, higher than 150 milligrams per deciliter. The best treatment for metabolic syndrome include exercise, weight loss, and medication if needed. Ever had medication side effects? Some of the side effects of psychotropic medications include dry mouth, constipation, weight gain, urinary retention, insomnia, headache, sedation, having tics, impaired coordination, tardive dystonia, and tardive dyskinesia are evaluated with an Ames test, and tardive dystonia and dyskinesia include movement disorders that involve involuntary muscles, and they may develop months, years, and even decades after taking antipsychotic medication. They involve involuntary muscle movements of the tongue, lips, face, trunk, and extremities that occur in patients treated with the long-term dopaminergic antagonist medications. Substance abuse and psychotropic medications. Combining psychotropic medications and alcohol will have side effects, and these include an increased risk of suicide, dizziness, increased risk of overdose, impaired motor control, problems with memory, increased depression, hopelessness, drowsiness, convulsions, disturbance of heart rhythm, causes sedation, damage of the liver, and loss of medication effectiveness. Bipolar disorder, also known as manic depression, is a mental illness that brings severe high and low moods and changes in sleep, energy, thinking, and behavior. The signs of bipolar disorder include feeling happy, high, or elated for long stretches of time, easily irritated, such as feeling jumpy or twitchy, talking very fast, often accompanied by racing thoughts, extreme restlessness or impulsivity, having an impaired judgment, an unrealistic overconfidence in your abilities or powers, engaging in risky behavior such as having unprotected sex, gambling with life savings, or big spending sprees. Symptoms of a depressive episode may include no interest in activities once enjoyed, loss of energy, difficulty sleeping, either sleeping too much or not at all, changes in appetite, eating too much or too little, difficulty concentrating, remembering, or making decisions, and thoughts of death or suicide. Symptoms of a manic episode may include feelings of euphoria, abnormal excitement, or elevated mood, talking very rapidly or excessively, needing less sleep than normal, yet having plenty of energy, feeling agitated, irritable, hyper, or easily distracted, engaging in risky behavior such as lavish spending, impulsive sexual encounters, or ill-advised business decisions. Schizophrenia is a long-term mental disorder involving a breakdown in the relation between thought, emotion, and behavior. This can lead to faulty perception, inappropriate actions and feelings, withdrawal from reality and personal relationships, into fantasy and delusion, and a sense of mental fragmentation. Some of the behavioral symptoms of schizophrenia include social isolation, disorganized behavior, aggression, agitation, compulsive behavior, excitability, hostility, repetitive movements, self-harm, or lack of restraint. Some of the cognitive symptoms of schizophrenia include thought disorder, delusion, amnesia, belief that an ordinary event has special and personal meaning, belief that thoughts aren't one's own, disorientation, memory loss, mental confusion, slowness in activity and thought, or false belief of being superior. Some of the moods someone with schizophrenia may experience include anger, anxiety, apathy, feeling detached from self, general discontent, inability to feel pleasure, elevated mood, or inappropriate emotional response. Some of the signs of schizophrenia known as negative symptoms, which are a lack of feelings or behaviors that normally are present, include social withdrawal, hostility or suspiciousness, deterioration of hygiene, flat, expressionless gaze, inability to cry or express joy, inappropriate laughter or crying, depression, and oversleeping or insomnia. Some of the positive signs of schizophrenia or feelings or behaviors that are not usually present include delusions, which are strange beliefs, hallucinations, hearing, seeing, smell, or feeling things that others don't, confused thoughts and speech, trouble concentrating, different movements, and racing thoughts. A personality disorder is a mental disorder characterized by unstable moods, behavior, and relationships. Personality disorders are classified in three types of behaviors: eccentric behavior, dramatic or erratic behavior, and anxious or fearful behavior. Displaying atypical behaviors can be a sign of a disorder. However, a professional evaluation will offer a more accurate diagnosis. The emotional symptoms of personality disorders can vary between disorders and express themselves to a different degree with each person, according to the Mayo Clinic. For example, people with avoidant personality disorder have an extreme aversion of conflict, allowing others to take advantage of them. Other symptoms can include poor impulse control and a propensity for substance abuse. Personality disorders affect the mind, but they can drive people to neglect their physical health as well. Someone affected by schizophrenia or a similar condition may neglect personal hygiene or suffer from insomnia due to fearful thoughts, while a person who is obsessive-compulsive may have raw skin from excessive washing. Some of the personality disorder symptoms include harmful impulsive behaviors, and these may include things like substance abuse, binge eating, out-of-control spending, risky sexual behavior, and reckless driving. Relationship problems. A person may see others as either good or bad and may shift from one view to the other suddenly for minor reasons. This can make relationships very difficult. They also may have a frantic fear of being left alone or abandoned. This fear may lead to frantic attempts to hold on to people around them. They may also have aggressive behavior, intense emotions, mood swings, and a low self-worth. Some other symptoms include feeling empty inside, problems with anger such as violent temper tantrums, self-harm such as cutting or burning themselves, suicide attempts and suicidal thoughts, and at times feeling paranoid or losing a sense of reality. Anxiety is a mental health disorder characterized by feelings of worry, nervousness, or fear that are strong enough to interfere with one's daily activities. Depression is a mood disorder causing a persistent feeling of sadness and loss of interest. Street drugs and psychotropic medication side effects. When a person combines cannabis with psychotropic medication, they are at increased risk for developing schizophrenia. It can worsen their existing psychotic symptoms. They may gain weight, feel sedated, and have tachycardia, which is a faster heart rate. If a person's taking heroin and they're prescribed psychotropic medication, some extra side effects may be a reduced respiratory rate. So heroin already reduces a respiratory rate, and it would be worsened with adding psychotropic medications. A decreased oxygen supply to the brain would occur. And if they're prescribed methadone, they may experience a longer QT interval, which is noted on an EKG. This is an arrhythmia or an abnormal heart rhythm. It would be best for a person before they start methadone treatment to have an EKG, so they have a baseline. If they use heroin on top of that, it affects their heart rhythm lowers their heart rate and their breathing rate and could lead to death. Heroin also causes sedation, and the sedation would be increased if they're also on psychotropic medications. Cocaine, SSC, and amphetamines. Cocaine can cause blood vessels to constrict, reducing the blood supply to the heart and brain. Cocaine and amphetamines can raise blood pressure and cause arrhythmias. Ecstasy can cause dehydration and hyperthermia. It is very important they drink lots of fluids if they're using this drug. And an increased risk of high blood pressure could occur with the combination of cocaine, ecstasy, amphetamines, and psychotropic medications, or even on their own. Some of the long-term effects that could happen to a person when they're abusing alcohol or street drugs would be effects on the liver, such as hepatitis or cirrhosis, an increased risk of diabetes, interaction with medications can be fatal, an increased mania or depressive symptoms noticed, exposure to blood-borne pathogens. This would be due to sharing needles or risky sexual behaviors. The next several slides are about communicable diseases. Hepatitis is an inflammation of the liver, and it may occur as part of a disease process. The diagnosis usually is made with elevated liver enzymes noted in blood work. Non-viral hepatitis is an inflammation of the liver, also known as cirrhosis, that causes scarring, liver cancer, liver failure, and death. There are three types: toxic, which is caused by drugs prescribed or over-the-counter, including nutrition supplements also; alcohol hepatitis, caused by excess alcohol consumption; and autoimmune hepatitis, which is caused by a person's immune system attacking their own liver for unknown reasons, or sometimes this is caused by some diseases or drugs of different types. If hepatitis, the term hepatitis, is followed with a letter such as A, B, C, D, or E, it is a viral-related type of hepatitis. Some of the symptoms someone would have if they had hepatitis include yellowing skin and eyes, known as jaundice, itching and a rash, light-colored stools, nausea and vomiting, loss of appetite, dark urine, abdominal pain, weight loss, joint pain, muscle aches, extreme fatigue, and sometimes no symptoms at all will occur. Hepatitis A, and this is abbreviated HAV for hepatitis A virus. This is spread through the fecal-oral route, usually from food or water contaminated with fecal material, or from close physical contact with someone infected with HAV. There's a vaccine that's recommended. It's 2 injections, 6 months apart, if someone's traveling outside the United States to a country that may have contaminated water or food. It would also be good for anyone to have this vaccination. There's no treatment for hepatitis A virus. However, symptoms of hepatitis A usually develop between 2 and 6 weeks after infection, and the symptoms are usually not too severe and go away on their own over time. The most common symptoms are flu-like, including nausea, vomiting, diarrhea, loss of appetite. Many people with HAV infection have no symptoms at all. People who do not have symptoms can still spread the virus, so it is difficult to know when a person has been exposed to this virus. The hepatitis B virus, abbreviated HBV, is found in blood and certain body fluids. The incubation period is 45 to 160 days. It is transmitted through contact with infectious blood, semen, or other body fluids. And an infant could get it during birth through an infected mother. And sexual contact with an infected person is another method of transmission, and sharing of contaminated needles or syringes. There is a vaccine available currently that is 3 injections, and a new one just came out that's 2 and is in the testing phase. Hepatitis B may lead to liver injury and potentially cirrhosis and cancer, and patients can either have an acute symptomatic disease process or be asymptomatic. HBV infection can be self-limited or chronic, and no specific therapy is available for persons with acute hepatitis B. Treatment is currently just supportive. The goals of pharmacology in patients with hepatitis B disease are to reduce the risk of progression of the disease, to prevent transmission to others, and to decrease complications. Hepatitis C virus, also known as HCV. It is estimated that 3.2 million people have chronic HCV infection in the United States. This can live 3 to 4 days in dried blood on any surface. It is spread through contact with blood of an infected person, through sharing needles or syringes, through sexual contact with an infected person, and a child can be exposed during childbirth by an infected mother, needle sticks or other sharp instrument injuries. Presently, there's no vaccination for HCV, and every chronic hepatitis C infection starts as an acute phase. Acute hepatitis C usually goes undiagnosed because it rarely causes symptoms. When signs and symptoms are present, they may include jaundice, fatigue, nausea, fever, and muscle aches. Acute symptoms appear 1 to 3 months after exposure to the virus and can last 2 weeks to 3 months. Acute hepatitis C infection doesn't always become chronic. Some people clear HCV from their bodies after the acute phase. Acute hepatitis C usually responds well to antiviral therapy. A chronic hepatitis C infection that continues over many years can cause significant complications such as scarring of the liver, liver cancer, or liver failure. There is a treatment now available for chronic hepatitis C that may provide a cure, but a person with hepatitis C needs to be evaluated by a gastroenterologist, physician, or liver specialist. HIV is the virus that causes AIDS. AIDS leads to attacks on the immune system, which allows opportunistic infections and cancers to thrive. In 2005, almost 75% of people diagnosed with HIV or AIDS were male. The largest number of people diagnosed with HIV and AIDS were gay and bisexual men. African Americans have the highest rate of HIV diagnoses compared to other races and ethnicities. Doctors can now prevent HIV from developing if they act quickly. A person who may be exposed can take anti-HIV drugs to protect themselves. They must start these within 72 hours of exposure. The medications can also have unpleasant side effects. Chronic HIV is treated with antiviral medications to help prevent the virus from increasing in numbers and attacking the immune system. These medications today may keep it under control as long as the medications are taken regularly and the person is living a healthy lifestyle. If a person with HIV does not seek treatment for the infection, it may remain asymptomatic for up to 10 years or more while it is destroying their immune system, and the person will remain contagious. If HIV remains untreated, it will turn into AIDS, and it will be deadly. Tuberculosis is a bacterial infection that can spread through the lymph nodes and bloodstream to any organ of the body. It is most often found in the lungs. It is spread through airborne droplets. TB time test measures exposure. TB bacteria can cause death of tissue in the organs they infect. It once was a widespread disease, but now we see multi-drug resistant TB. Symptoms of TB are a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or sputum, phlegm from deep inside the lungs is coughed up, and other symptoms of TB are weakness or fatigue, weight loss, no appetite, chills, fever, and sweating at night. Meningitis is an inflammation of the coverings around the brain and spinal cord. Viral meningitis is more common but not as serious as bacterial. Bacterial meningitis needs to be treated immediately to prevent brain damage and death, and the symptoms are the same for both. A stiff and painful neck, especially when trying to touch a person's chin to their chest that has this, and also fever, headache, vomiting, and/or seizures may be present. Methicillin-resistant Staphylococcus aureus, also known as MRSA. This infection may appear as a skin infection like a boil, abscesses, or cellulitis. The bacteria is found in urine, respiratory secretions, and blood. It is resistant to common antibiotics like penicillin. And vancomycin is one of the drugs used for treatment, and right now it is a drug of choice, but there is also vancomycin-resistant enterococci. That means that MRSA can be resistant to vancomycin, and when this happens, some lab tests are done to tell which antibiotics will kill the germ. And most of these type of infections occur in the hospital. In the general community, MRSA is most often causing skin infections, and the symptoms are redness and painful and swollen areas. It can be prevented from being spread by washing hands often and covering wounds until they are healed. And do not share personal items. Bedbugs are a small, oval, non-flying insect that feeds by sucking blood from human or animals. They are most commonly found where people sleep, like mattresses and bed springs. They are most active at night and bite any exposed areas of the skin. They are small, flat, raised bumps on the skin that are the most common signs. A professional pest control company may be required to help identify and remove bed bugs. Scabies is a skin infection caused by a type of mite that burrows or tunnels under the outer layer of a person's skin. The mites lay eggs under the skin that feed on the blood. It is very contagious and is transferred by direct skin contact. The most common symptom is extreme itching. The skin becomes reddened and blistered. It is important to remember that the first time a person gets scabies, that they usually have no symptoms during the first 2 to 6 weeks they are infested. However, they can still spread scabies during this time. Products used to treat scabies are called scabicides because they kill scabies mites, and some also kill mite eggs. Scabicides used to treat human scabies are available only with a doctor's prescription. No over-the-counter or non-prescription products have been tested and approved to treat scabies at this time. Athlete's foot is a condition that is caused by fungus growth on the feet, mainly the soles and between the toes. It is caused by a variety of fungi when there is excess moisture, insufficient air circulation, or abrasion. An antifungal cream or lotion or powder can treat this condition, which is mildly contagious by direct contact and skin particles left on surfaces. For care of the feet, keep feet clean and dry and wear shoes in public places. Apply medication as ordered and wear white socks, which can help monitor for any types of drainage. A doctor could write a prescription for a stronger type of medication, but it also is available over the counter. Ringworm is a fungal infection of the skin. It is distinguished by a ring or rings surrounding the rash. It is treated by an antifungal cream, lotion, or ointment. It is very contagious and spread by skin-to-skin contact. Lice is the parasitic insect that can be found on the head, eyebrows, and eyelashes of people. They lay their eggs in body hair or clothing fibers. After the eggs hatch, they feed on human blood several times a day and live close to the human scalp. They are not known to spread disease. Anyone coming into contact with someone else that has lice can get it. Indirect contact with personal items can also spread lice. A medicated shampoo is the treatment. Pinworms are small roundworms that live in the lower GI tract, and they come out at night and lay eggs. This is spread through the fecal-oral route. Transmission can occur after contact with contaminated bed linens, clothing, toilet seats, sand, and food, and usually all the members of the household are treated at once to eliminate the disease. Scotch tape may be used in the diagnosis process, and this is used at the anal area to check for pinworms. Rubella, also known as German measles. This is a virus that is most often spread when an infected person coughs or sneezes. Transmission is airborne or direct contact to droplets of fluid from the mouth, nose, or eyes, touching items or breathing in the airborne droplets. This may produce a 3-day rash, fever, headache, achy joints, and enlarged lymph nodes. It is usually very mild, with few noticeable symptoms. For children who do have symptoms, a red rash is typically the first sign. It's relatively a short-term illness, and it resolves within days to a couple weeks. It is very contagious to others a week before and a week after the rash appears. However, some people do not develop a rash. If contracted during the first trimester of pregnancy, serious birth defects can occur. Rubella is part of the MMR immunization series. The health department will help track down contacts if a person thinks they exposed other people. Chickenpox is caused by a virus, and the illness usually lasts about 5 to 7 days. The classic symptom of chickenpox is a rash that turns into itchy, fluid-filled blisters that eventually turn into scabs. The rash may first show up on the face, chest, and back, then spread to the rest of the body, including inside the mouth, eyelids, or even genital area. It usually takes about 1 week for all the blisters to become scabs, and then at that point it is no longer contagious. Even though it's highly contagious, there is a vaccination available for people of all ages. Usually it starts after 12 months a child can get a vaccination. Chickenpox is transmitted by respiratory secretions or direct contact with skin lesions, and the incubation period is about 14 days after exposure. It is more serious when adults have chickenpox because an adult is more likely to develop the complications of it, including swelling of the brain or spinal cord, which is meningitis. It is also very serious in infants under 12 months of age, in adolescents, and people that have weak immune systems. For care of a person with chickenpox, discourage scratching, use calamine lotion, and recommend oatmeal baths. Shingles is a viral infection caused by the reactivation of the herpes virus that has been dormant since a previous episode of chickenpox. This dormant virus is stored in the spinal cord. Fluid-filled vesicles are the appearance of shingles. It is extremely painful. There is a vaccine now available. Care of the person with shingles includes discouraging touching or scratching the vesicles, and pain medications if needed. According to the CDC, approximately 1 million people develop shingles in the United States each year, and in most cases it is non-life-threatening, but the pain caused can last for months. Shingles can affect anyone at any age that has previously had chickenpox, and factors that increase a person's chances of developing this condition include being over age 50 and having a disease that weakens the immune system. The vaccine decreases a person's risk of developing shingles. There is no cure, although medications are available to treat it topically and for pain. Herpes viruses are extremely contagious, and herpes simplex 1 is cold sores of the lip area. It's transmitted by oral and respiratory secretions and drainage from lesions. There are now medications available like Valtrex and Abreva that are topicals, and they help stop the itching and burning and spreading. Care of the person with cold sores include proper hand washing and advising people not to kiss, and observe for eye lesions. Gastroenteritis, also known as the stomach flu, is an inflammation of the lining of the intestines, and this may be caused by bacteria, viruses, parasites, drug reactions, food allergies, or ingesting contaminated food or water. It has an acute onset, and care of the person with gastroenteritis includes meticulous and frequent hand washing and avoiding dehydration. Impetigo is a contagious skin infection that is usually caused by staphylococcal, known as staph, or streptococcal, or strep, bacteria. The first sign is a patch of red, itchy skin, possibly with blisters around the mouth and nose, or occasionally in the extremities. The blisters can burst and ooze, and then the fluid will dry and leave a crusty, yellowish, brownish, golden crusts around the mouth or wherever those blisters were located. And the symptoms usually go away without treatment, but this depends on the type of impetigo and the severity of symptoms. A doctor may prescribe an antibiotic, ointment, or oral antibiotics. And be aware that impetigo spreads easily among infants, children, and the elderly. Care of a person with impetigo includes frequent and meticulous hand washing, medications as ordered by a physician. You want to discourage scratching because it spreads impetigo, and observe others for infection because it's contagious, and do not share personal belongings. How can we help others? Educate, empower, advocate, and listen. Health concerns and psychiatric illness quiz. Number 1. Another word for high blood pressure is hypertension. True or false? Number 2. The main cause of COPD, congestive obstructive pulmonary disease, is. Number 3. COPD occurs during childhood. True or false? Number 4. The letter A, B, C, D, or E that occurs after hepatitis denotes it as being a virus. True or false? Number 5. A medication side effect could be. Here's the quiz answers. Number 1. Another word for high blood pressure is hypertension. This is true. The main cause of COPD is smoking. Number 3. COPD occurs during childhood. That's false. Number 4. The letter A, B, C, D, or E that occurs after hepatitis denotes it as being a virus. This is true. Number 5. A medication side effect could be dry mouth or constipation or weight gain, and there are several things that could fill in this answer. Here are some community-based resources: the Oakland County Health Department, Michigan Diabetes Association, Michigan Heart Association, Asthma and Allergy Foundation of America, the Michigan chapter, the American Lung Association, and the Michigan Cardiovascular Association. Here's a list of resources for mental health and substance use services: the Michigan Department of Health and Human Services, the Michigan Mental Health Networker website, Oakland County, Oakland Community Health Network, Common Ground Resource and Crisis Center. They're a 24-hour emergency crisis and helpline, and the PACE program of Oakland County. This is for substance abuse services. My Strength. This is the health club for your mind. It is a web-based resource you can use on your phone or laptop or desktop computer. It offers mobile self-help resources to empower individuals to be active participants in their journey to becoming and staying mentally and physically healthy. Anyone that works at OCHN or any of the providers and any of the individuals we serve may use My Strength. With the iPhone and the Android phones today, there's a variety of health apps you can add to the phone. And here are some apps for the iPhone or Android phone. Related to substance use, mental health, and medications, there's My Strength, examples of drugs.com, medication reminder apps, and recovery apps. Here's a list of web resources used for this PowerPoint. thenationalcouncil.org, the nation's voice of mental health and addiction providers. MayoClinic.com, this is information regarding health care. CDC.gov provides safety, health, and prevention control information. SAMHSA.gov, this is a federal agency advocating for prevention, treatment, and rehabilitative services in order to reduce recovery rates. EatRight.org, this is the Academy of Nutrition and Dietetics. Diabetes.org, fight the consequences of diabetes and help those affected by diabetes. MindYourHeart.org, this impacts physical health and cardiovascular health. Livestrong.com, health and fitness information. And ChooseMyPlate.gov, this incorporates healthy eating tips. This concludes our presentation on health concerns and psychiatric illness. If you have any questions or concerns, please call Susan Stevens or Nicole Brown. Thank you for watching.